I think it's 4 minutes past, so I think let's let people join as they come in. So, welcome everybody. Really pleased to have you here. I'm going to try and have the windows on my screen arranged so I can see the chat and my script and you, but it might not always work that way. So there are going to be a few people on the call who I've not met. Welcome everybody. My name is Naveed Chowdhury. I'm head of campaigns at Results UK. Welcome to this call. I hope you'll find it useful. So you may or may not know that Results UK is an international development organisation that is focused on advocacy, that is campaigning for change. We don't run any overseas programmes, but we work on basically health, education and access to economic opportunities. And obviously nutrition is a key part of health, as you will hear. We are going to probably not say anything much more about Results at the moment, but if it comes up in questions, that's absolutely fine. I want us to just kick straight into kind of how we're going to run the meeting. So just a bit of meeting etiquette, if that's okay with you. Please put yourself on mute. I think most people have already. And if you've got any concerns or questions, just put them in the chat box and we'll try to address them. There will be dedicated time for questions at points during the session. As I said, we're going to try and cover a lot, but please do ask if there's anything you don't understand as we go through, because the chances are there'll be other people thinking a similar thing. And the session will take about an hour and a half, and we have a 10-minute break just about halfway through. So I will assume that if anyone's got any questions or concerns, you're going to put it in the chat, or basically speak now or forever hold your peace. Okay, so as I say, welcome. We've had a few new people joined, and that will be happening throughout. So we'll just let people in. We are recording this session so that people who missed it will be able to see it. So if you're not comfortable about that, I think mostly it'll be speaker view, so you won't appear. But if you're worried, just turn your video off. That's fine. So the purpose of today. Basically, we are here to learn about where we are with global nutrition. This is something that I know there are some people who've signed up for this course who've been with us for quite a long time and will be aware of campaigning on nutrition over a period of time, and things have changed. And so we kind of want to say, where have we been with nutrition? What's happened in the world? And what are the next steps? What are the things that we kind of need to do next? This is about nutrition advocacy. We're not going to go into details of kind of the sort of clinical side of things, or we're not trained nutritionists. What we're here to do is to say how things can be, how we can influence things in the world that will impact on the amount of people who are having good nutrition, which is absolutely critical for health. So well, we're also going to hopefully give you a reading list at the end, and don't worry too much about taking notes, because we will also share these slides. So I'm just going to run through a couple of things quickly before handing over to Mathilde. Results has worked on combating global hunger and malnutrition basically forever. But it's really important to distinguish between the two things I said, hunger and malnutrition. This is distinguishing between the quality and quantity of food intake. And this is something that's really not still widely understood by politicians or the public. If you think about what's being talked about at the moment in the news with the East African food crisis, you'll probably see lots of stuff about people not getting enough food and the kind of images that you see on the TV. That's just been there forever. This is a part of the story, but what we're really talking about is a much wider range of people also who may have enough basic food intake but don't get the right nutrients. And so we're going to go through that. I'm just going to, before I hand over to Mathilde, I'm going to just quickly talk about the history over the last few years of our campaigning on nutrition. And the first thing to mention, some of you will be very familiar with this already, is a thing called the Nutrition for Growth agenda. We call it N4G, Nutrition for Growth. And Britain co-hosted a summit in 2013 on this, which was quite a milestone, actually. We co-hosted it with the government of Brazil and some others. And we gained more than $4 billion US dollars in pledges from international donors for direct interventions to improve nutrition, and a further $19 billion for what's called nutrition sensitive programs. Now, these are programs that maybe aim to do a different thing other than nutrition, but actually have an indirect impact on reducing malnutrition. The UK government pledged a total of 1.25 billion until the end of 2019, and it also committed to reach 50 million women and children through nutrition interventions up until 2020. And it achieved that, which was absolutely brilliant. However, when that pledge ran out, the UK did not have plans in place to continue its nutrition commitments, and it has, in fact, to this day, not renewed that pledge. So we're in a situation where historically the government has given quite a lot of money, but it's got very small amounts pledged at the moment, and you'll hear a little bit more about that at the moment. On your screens now, you see a slide there. I'm going to rush through this very quickly, but we as Results have been campaigning on this issue right through from 2013. There was supposed to be a moment to renew and review commitments in 2016. You can see there a slide. That's actually a picture of the beach in Rio. The Rio event was a bit of a non-starter for political reasons. Then there's another one in 2017 in Milan. And then in the run up to 2021, where that whole agenda and the Nutrition for Growth agenda was supposed to run out, we were campaigning at the end of 2020 for the UK government and others to recommit money. But obviously we've got a financial crisis and we've had all sorts of political reasons why that has been harder than we thought. And for those of you who've been sticking with our advocacy and campaigning on this over a period of 3-4 years, I hope you'll recognise some of these milestones. So we're not starting from scratch. We are through a period where we've been campaigning on this for a long time. We, I hope, have a reasonable amount of expertise on it, which we'll share with you as we'll get into the details. This is just literally a historical overview. And just before so I should say, yeah, I'll just say that I said we've committed very little just a minute ago. Back at the beginning of this year, the UK government committed 1.5 billion until 2030, which sounds like a lot, but it's actually a very significant reduction from that former level of funding that I told you about before. So there's a question of, are we giving enough? Are we helping enough to overcome malnutrition and to meet the goals that we have as a world? And then, you know, what do we do next? And I have to say that Results campaigners have played a big role in keeping the government's focus on this, despite the cuts. So, for example, last year, the government committed to using a thing called a policy marker, and I won't get into the details of that right now. An OECD policy marker, it's called, which is a thing which it helps you to evaluate the design of all development programs and then enable you to check in on whether it's designed to have an impact on malnutrition. And this was quite a big win, particularly given more limited resources. We need to be able to see very clearly how much impact we're having on nutrition and actually measure it. And we're getting a bit technical there, so I'll leave that and leave any more details on that for questions. Just one last thing. I'm going to show you a slide very briefly. The next slide, please, Mathilde. If we always like as Results to talk about human stories, and for me, this is a story we used, as you can see there, a few years ago now, 2016. But for me, this was a very stark image. Believe it or not, these two boys who are from Madagascar, this picture was taken in 2016, are both exactly 5 years old. They're born on the same day. One boy, the boy on the left, called Miranto, has been in school at that time for a couple of years, had lots of friends, and growing normally. But his friend Sitraka, unfortunately, was from a family that couldn't access good nutrition in the first years of his life, couldn't go to school, and basically he's not going to grow up in a normal way. His growth as a human being has been irreversibly harmed. And we don't like using kind of scare stories particularly, and we also we do try to be respectful of people whose images we use in this kind of material. But I don't think you could want a starker example of the importance of malnutrition and good nutrition in the first few years of life than this slide. So that is kind of the end of my introduction in terms of where we've been, why it matters, and I'm now going to hand over to my colleague Mathilde, who will take us through the bulk of this event today. Mathilde, are you able to show yourself on video? There you are. Yeah, I can see you. Hello. Mathilde works at Results UK as the Policy Advocacy Officer for Nutrition. She's a real expert and will be able to answer all of your questions, but she's going to take us through the rest of this presentation, and I think I'm just going to hand it over to you, Mathilde. So over to you.
Thanks, David. And hi, everyone. So yeah, hi for those I've not met yet. Yeah, it's really a pleasure to spend this evening with you for this training. Thanks a lot for joining. So for the rest of the training, so it will be divided into parts. So in the first one, I'm going to cover understanding malnutrition and then advocating against malnutrition. So before I get started, I'm going to use a couple of acronyms sometime while speaking. So I put that in the chat so that will help you understand what I'm talking about. So WHO stands for World Health Organization. N4G, you're going to hear me using this term a lot during the training, is Nutrition for Growth Summit. APPG, all party parliamentary groups. I will explain them as they go, so that at least you have the full explanation. So let's get on the first part about understanding malnutrition. So before, it's quite important to understand that the World Health Organization categorizes nutrition in three parts. The first one is undernutrition, so that includes wasting, that includes stunting and underweight. The second one is macronutrient-related malnutrition, so that includes macronutrient deficiency or macronutrient excess. So, for example, a lack of important vitamins, mineral, or excess of them. And the third one is overnutrition, and that includes overweight, obesity, diet-related non-communicable diseases. So, for example, heart disease, stroke, diabetes, and some cancers. So it's important to understand because malnutrition is a risk factor of the cycle of poverty, which is why Results advocates for the end of malnutrition globally. So malnutrition threatens the survival, progress, and potential of the individuals, thus keeping them into a malnutrition, illness, and poverty cycle. So why is that? Because malnutrition increases healthcare cost, it reduces productivity and people's potential, and it slows their economic growth as well. So it can perpetuate a cycle of poverty and ill health. We say also that poverty amplifies the risk of and from malnutrition. So people who are living with low income are more likely to be affected by different forms of malnutrition. And it's important to understand that every country in the world is affected by one or more forms of malnutrition. Malnutrition forms one of the greatest global health challenges. So in our advocacy now, we start talking more and more about the double burden of malnutrition. So the double burden of malnutrition refers to the simultaneous development of two or more types of malnutrition. So for example, overnutrition and undernutrition combined. So this is the case, for example, if someone develops obesity or anemia at the same time. So in that case, we talk about double burden. And according to WHO, so the World Health Organization, nearly 1 in 3 persons in the world suffer from at least one form of malnutrition related to either undernutrition or overnutrition. So tackling the double burden of malnutrition is essential to end poverty and to save lives. Both undernutrition and overnutrition have long been recognized as raising the likelihood of diseases and preventable death. And undernutrition alone contributes to approximately 45% of deaths in children aged under 5 years globally, while most low and middle income countries are now witnessing a simultaneous rise in childhood overweight and obesity. So the double burden of malnutrition has been linked with also lower socioeconomic opportunities, low education outcomes, and the perpetuation of the cycle of poverty, ill health, and also gender inequalities, as I've mentioned. So in our advocacy, why is it important to focus on the double burden of malnutrition generally? So addressing this is essential to mitigate the damaging health, economic, and equality impacts on individuals and population rights to good nutrition and health. So I'll cover later what we mean by the right to good nutrition and health. But it's important for our advocacy given the coexistence of multiple forms of malnutrition and their shared risk factors. Advocating against the double burden of malnutrition is an opportunity to address policy challenges beyond health that affect nutrition outcomes as a result. And that includes social underlying determinants of nutrition and inequities within population. And the World Health Organization recommends achieving multiple goals and targets, for example, the global nutrition targets, with joint intervention, joint programs, or policies that have the potential to simultaneously reduce the risk of both undernutrition and overnutrition. So I've just mentioned the global nutrition targets. So what are they? To accelerate progress and global action in addressing malnutrition, the World Health Organization, during the World Health Assembly, which generally takes place in May each year, endorsed a resolution in 2012. And the aim was to create a supportive environment for the implementation of comprehensive food and nutrition policies. So this will help governments, but also UN agencies and other partners to include all required effective health interventions with an impact on nutrition in national nutrition plans. It's also very helpful for us advocates because they stimulate the development of policies and programs outside the health sector that recognize and include nutrition. So with these targets, we are equipped with WHO recommendations, and we can advocate directly to governments for sufficient human and financial resources for the implementation of nutrition interventions, and also to effectively monitor and evaluate the implementation of those policies and those programs. So more specifically, what are they, these targets? So there are 16 totals. 3 of them are aimed to achieve a certain level of reduction in undernutrition conditions, such as stunting, anemia, and low birth weight. There is one to ensure that there is no increase in childhood overweight. Another one for promoting exclusive breastfeeding and reduction of childhood wasting. So they are used for policy and advocacy purposes. And an organization called the Global Nutrition Report collects data sent by government and track the progress of all the targets. So it's very, very helpful in our advocacy. So at this point, I would like to show you how we are actually using them by showing you the website of the Global Nutrition Report. So I'm going to briefly stop sharing this slide and share another screen instead. So bear with me 1 second. Can you see this? Okay, thank you, David. See you nodding. Right, can anyone please unmute and tell me one country, pick a country, and we're going to see together how they are in achieving the nutrition targets.
Brazil.
Brazil, okay, let's go for Brazil. So what do we see? So we have a full summary on how Brazil is doing, and we see that unfortunately for childhood stunting, there are no progress or worsening, which is the same for low birth weight. Brazil is on course for achieving the target on childhood overweight and raised blood pressure on women. So these are sub-policies, actually. They are not directly including the targets, but they are sub-policies. There are something, that is quite important for us to note is the fact that there's no data sometimes. For example, for excluding breastfeeding, there's no data, which is a big problem for us advocates to not having access to them. And it can be a part of our advocacy to ask governments to publish those data and to report them to the Global Nutrition Reports. Do you want to pick another one?
Hello, Zambia.
Zambia, thank you very much for that suggestion. Let's see how Zambia is doing. So again, we have the full description. And so they are actually reporting on different targets. So you see like there is, oh, actually that's a good example. There is no targets that are not reported. So that's quite good. Actually, unfortunately, some progress are still needed for anemia and exclusive breastfeeding, but they are on course for childhood overweight and for child wasting, which is really good. And also, you're gonna have access with the slides to those links as well if you want to have a look. But there is another table where you can see like the countries that are on track for achieving 0 target, 1 target, 2, 3, or 4 targets. So there you can see like where those countries are standing. So it's quite a useful website for us advocates to check where countries are.
In the chat, Mathilde, we have Spain.
Oh, sorry, I didn't see. All right. Sorry, I'm gonna reshare my screen. Thank you, Navid, for flagging. So, how Spain is doing? So they are good on diabetes for women, raised blood pressure for women, raised blood pressure for men. But again, that's a big problem. No data on exclusive breastfeeding, nothing on child overweight, nothing, which is quite disturbing to not have those data because they are quite important. So yeah, so this is how we know where to push for in terms of policies for specific undernutrition or overnutrition diseases. So, yeah. And you're going to have those links if you want to check specific countries after the training. So I'm going to go back to the slides in a minute. Here we go. So as you could see from the countries that we have brought, but it's a general thing actually. The world is completely off course to make these targets, showing that tackling the double burden of malnutrition has not been sufficiently prioritized either financially or through adequate policies. And the Global Nutrition Report made global analysis in 21 of countries' progress, and they found that the world is not on track to meet 5 of the 6 targets. And poor diets among adults account for 12 million avoidable deaths in 2018 alone. And there is a very concerning high prevalence of anemia among women and girls of reproductive age, with little progress in lowering it. And so they have assessed a total of 194 countries, and they found that 89 of them are not on course to meet the targets on child overweight by 2025, because I don't know if I mentioned that, but the targets have to be met by 2025. And approximately 3/4 are predicted not to meet stunting and wasting targets. And the worst is that anemia levels are showing no progress or worsening in 161 countries. So I think this is something you could have guessed from the 3 countries that we have shown. They are sometimes like even worsening, not even making progress. And Guatemala is the only country in the world to have been assessed as making sufficient progress to meet the global nutrition targets on anemia. And given the critical role of nutrition for improving health outcomes and reducing poverty, so there is an urgent need and strong intervention from governments and policymakers to meet the targets by 2025. And so these interventions include adequate nutrition policies, financing program covering the needs of population. Do you have any questions so far? I'm happy to take questions at this point. I see Sarah, you have your hand raised. Please go ahead.
Hi. I was just wondering, with the Global Nutrition Report, does it account for regional differences? So with the example, Brazil that was used, that's of course a massive country, and I would assume that there would be quite a big north-south divide. Yeah, so basically, does it account for regional differences? Does it show the geography of nutrition on that website?
That's a good question. So directly on this track and this website, we can't see the regional divide, but if we speak to advocates based in Brazil, they will be able to tell exactly where the trends are in terms of progression for in terms of reduction of malnutrition. So this is just the country profile, and what they are doing that is because during the previous couple of Nutrient for Growth summits, governments made promises, either financially, politically, and they have adopted and signed off for meeting the global nutrition targets by 2025. And so the aim of this website is really to track their progress against their commitments. So it's general for the whole country. Actually, no, the website doesn't show that by region. Thank you for asking.
Can I just ask, how do they, you've got all the measurements, how do they measure these? They're not testing everybody, are they? How do they do it?
Sorry, I'm not sure I get the question.
Well, you said the percentages are below and above, and 5%, 95% of this. How do they sort of measure that? Are they measuring every child in the countries? How do they sort of get those figures about the stunting and the malnutrition, and how do they get those figures?
Thank you for asking. So each government, so it's usually the equivalent of the Ministry of Health, doing that. They have to report those data to the global nutrition report. So our guess is that they have their own national system of reporting and collecting those data. And if they don't report on those data, especially on breastfeeding, as we have just seen, is because there is a need for pushing more national regulation and policies for collecting those data. So every country has a very different way of doing it. So I don't think I can give justice for every national system on how they are doing this. But when committing the global nutrition targets, they are also committed to have those systems in place for collecting those data and monitoring them carefully. So I'm not sure I can tell exactly what's happening in countries, but yeah, they should report on them for sure. Thank you for asking.
And I'll just jump in here and say, so at the beginning, we're not the technical experts on the actual management of nutrition programs and clinical outcomes. So we'll generalize a little bit. Thank you for asking those kind of questions. And in some cases, we may be able to follow up with some further information. We'll give you some links to further reading, but to some extent, there'll be some granularity that we haven't got the expertise to delve into, I'm afraid.
Any other question? That won't be it's not the only occasion to ask questions. So I will just ask it like your people. Do you have any other one you want to ask at this point?
Go ahead, Marcelo.
Hi, thanks, Matilda. My question is in regards of, since we're talking about nutrition and malnutrition, is results, perhaps you've already said it, but I didn't catch it, is results part of the movement on scaling up nutrition, or is it the UK included in that movement within the United Nations? Do you know?
Thanks for asking. Yes, so we work with the Sun movement, actually, especially with the youth leaders for nutrition, so that we are not calling the national youth coordinators because there has been some changes. But yes, we actually work with them and very closely with Save the Children, who provide the secretariat for the youth leaders and for some Sun activities as well.
Thank you.
Thank you for asking. Okay. Oh, I see something in the chat. That's you, Navy. Thanks. Excellent. So I'll go ahead then. So for the rest of this part, I'm going to cover some of the content of two of our policy reports. The first one is Nutrition as a Human Right, which published in January 2021, and the second is Malnutrition Sex, which was in June 2021. So in the slides, you also have the link to those reports for, if you want to read them later. So a key part of our advocacy on nutrition consists at referring as a human rights issue. So human rights basically is an approach, it's a conceptual framework for policies and programs which are normatively based on international human rights standards and principles with the purpose to promote and protect human rights. And when we talk about rights-based approach, the United Nations often refer to the panel principles, which are displayed on this slide. So panel stands for participation, meaning that people should be involved in decisions that affect their rights. Accountability, a very important one, means an effective monitoring of appropriate laws, policies, administrative procedures, and all the mechanisms to secure human rights. Non-discrimination, because all forms of discriminations must be prohibited, prevented, eliminated, and the most vulnerable facing the biggest barriers to realizing their rights should be prioritized. E for empowerment, meaning that everybody should understand their rights and be fully supported to take part in developing policies and practices which affect their rights and their lives. And legality, because this is a key part of human rights, actually. The recognition of rights are legally enforceable entitlements set out in domestic and international laws. So states are actually legally accountable for the realization, the protection, and the promotion of rights. So it's quite an important thing to understand. And human rights are all universal, inalienable, and interdependent and indivisible, which means that the achievement of one right cannot be complete if other rights are not fulfilled as well. So as good nutrition outcomes involve a variety of interventions, so for example, agriculture, climate, access to nutritious food, nutrition, healthcare, and education, it follows that it depends on the realization, the nutrition outcomes therefore depends on the realization of other human rights, such as the right to information, to education, the right to land property, the right to health, etc. And nutrition is found and described as a fundamental human right in several international treaties, creating legal obligation to states to promote and to fulfill human rights. And this connection is important to make for our advocacy because it reinforces the message that for tackling the double burden of malnutrition, all governments need to implement policies and programs within and outside the health sector that recognize and address malnutrition. So this is the case, for instance, when policies and programs for, let's say, better education, implement nutrition education and free, healthy schools meals. So this is an example of when the achievement of multiple rights is taking place. In our advocacy, we also say that nutrition is a gender equality issue. So we know that more than 1 billion women in the world experience at least one form of malnutrition. So they experience higher rates of anemia, of overweight, and obesity than men, especially women with lower socioeconomic status. And we even found that malnutrition is the single largest cause of death among women. So it's killing more than any other risk factor, and that includes alcohol and tobacco. And with the COVID-19 pandemic, it exacerbated the already existing burden of malnutrition in women and girls. And it's estimated, for example, that 630.2 million adolescent girls and women aged between 15 and 49 years of age are affected by anemia. Before going further, I need to clarify in advance a word that I'm going to use quite a lot in the rest of the presentation, the word determinants and drivers of malnutrition. So we are calling drivers and determinants of nutrition all the root causes shaping the health, but also the social environment and the food systems of the population, as the cultural environment. So we are calling them drivers and determinants. So in general, the higher rates of anemia and micronutrient deficiencies in women and girls reveals a variety of social factors, making women more susceptible to malnutrition than men. And as I've said earlier, good nutrition outcomes depend on the realization of several human rights. And it means concretely that many interventions across different development sectors are involved. And these interventions are needed to address the social determinants of nutrition because they are the key drivers to women and girls' health and development. And what does it mean concretely? It entails removing the economic, social, and cultural barriers that create the underlying and systemic causes of gender inequalities and malnutrition. I've already mentioned the report, Malnutrition is Sexist, And in this report, we've shown how malnutrition in women and girls is associated with social determinants, such as insufficient access to quality education. But this is only just one example, because many social determinants and institutional structures also reinforce gender inequalities that impact women and girls' health and nutrition. And these barriers can be found in food system, where women's roles vary quite disproportionately, and where they continue to face discrimination in decision making, but also in access to information, in access to land and resources. And they exist also in health systems. So for example, during the pandemic, we found in our research that a lot of nutrition health services everywhere in the world were not considered as essential services, which they are for the nutrition outcomes and health of women. So a rights-based approach to nutrition is essential for tackling oppression. And this is something that is quite important for advocacy at Results. So to make progress on the reduction of the double burden of malnutrition, our advocacy should focus on the participation of population who are the most at risk and or affected by malnutrition in every decisions affecting them. So a human rights-based and gender equality approaches, they are effective tools for advocating for better nutrition, because they ensure that those who are the most affected by malnutrition are at the center of decision making. And these approaches prioritize the nutrition outcomes of individuals as fundamental rights. And so it's prioritized above other political or economic aims that could affect population's health. And they have a strong anti-oppression logic, because they promote participation, non-discrimination, which are fundamental values in ensuring that individuals are meaningfully involved in the decisions affecting them at all stages. Do you have any questions?
Mathilde, I just wanted to mention, you talked about anti-oppression values, and I noticed that the captions mistranslated it as entrepreneurial, so people might have misunderstood that. Do you want to just repeat what you meant there?
So about anti-oppression. So yes, so I was saying that the human rights based approach and the gender equality approach for tackling malnutrition have a strong anti-oppression logic, because they promote the right to participation and the right to be free from discrimination. And these are really fundamental values that ensure that individuals are involved in all decisions affecting them and affecting their health. So hope that gives justice to the world this time. Do you have any question? If not, can I continue? No question? Okay. So for the next couple of slides before we go on activity and then the break, I'm going to talk about the direct and the indirect drivers or determinants of malnutrition globally. So just to recall, we are calling drivers and determinants of nutrition the root causes shaping the health, the social environment, the food system of the population, and their cultural environment. And they are very, very important in our advocacy, because these determinants influence the type of food a population eats, the service they have access to, the nutrition outcome as a result. And they're important to understand to advocate for the adequate policies and financing that will tackle the double burden of malnutrition. When talking about the direct and indirect drivers of malnutrition, it's important to note that they are infinite determinants of nutrition. So this training gives an overview of the major drivers of malnutrition that are the most relevant for advocacy. And these drivers are not mutually exclusive, because they interact to the detriment of nutrition by creating multiple compounding impacts at many different points within our food systems. And the drivers are found in two distinct categories: the direct determinants and the indirect determinants. So we have tried to summarize this concept with this graph. So you can see what influence nutrition outcomes above. So we have first the access to preventive and curative nutrition healthcare. The second direct driver is the access to nutritious food. And this one is completely dependent on the function of food system. And food system are influenced by 4 drivers: climate variability, conflicts, poverty inequalities and social determinants, and economic slowdowns. So as I said, there are also like multiple other drivers, but we are focusing on the ones that are important for advocacy directly at results. And let's then first focus on the 2 direct determinants. So the one that you can see influencing directly nutrition outcomes above. So there are 2 of them: access to nutrition food. It refers to the ability to afford a sufficient amount of nutritious food and the ability to physically access places where food is sold and distributed. So it involves the stability of food supply over time and at all places, and the nutritional value of food to meet the nutritional needs of individuals. And this is very key. And this is why we are talking more about nutrition outcomes and more than food security. The nutritional aspect is absolutely key in here. And this driver is heavily influenced by the functioning of the overall food systems. The second one is nutrition healthcare, and it includes all the fundamental services in preventing and treating acute malnutrition. And this one must be protected and designated as essential services at national levels, because it really ensures equitable access to effective nutrition interventions within health system. It plays a vital role in improving diets and preventing and treating disease. So I've talked a lot about food system, but what are food systems exactly? So I'm going to show you a very scary graph. It's scary for a purpose because it really shows you the complexity of food system. And it's quite important to understand how food systems are influenced and how they influence nutrition outcome, because the disruption of food systems, as we could see during the pandemic or right now with the war in Ukraine, they increase the rate of food insecurity and malnutrition. So if there is something we can understand from this slide, is the fact that the external drivers above are multiple, and they influence 3 big, we say, determinants. So food supply chain, they influence food environments, and the individual levels of filters. And all of these 3 will influence consumer behaviors, which then will influence diets and the health and nutrition outcomes. So it's also important to understand that this food system structure is also the one in the UK. So it applies to every context. But for the sake of this training and for advocacy, we like to simplify things and focus on the 4, I would say, drivers of food systems functioning. So climate variability, conflicts, economic slowdowns, poverty inequalities, and social determinants. So these are the drivers of food systems, but we refer to them as the indirect drivers of nutrition outcomes because they don't affect nutrition outcomes directly, they affect them through the food system functioning. So do you have any question at this point? Because it became a bit technical. So I have a slide for questions, but perhaps you need to look at this for continuing questions.
Mathilde, there's a point in the chat. Echo has pointed out that there are many different kind of choices that people make within food systems, including dietary choices such as vegetarianism or veganism, or people who need to be gluten-free, which add to the complexity of the drivers. Did you have any observations about that?
You muted me, David. So let's go back for this question to the scary slide. So if you look at the column individual level filters, so you have the economic, cognitive, and situational. These are actually fitting into this question because the aspirational parts includes the desires, the value and preferences of individual in terms of the food choices, but also the cognitive aspect, like what do they know, how do they understand nutrition? And it's different in all contexts, so the the food aspiration from someone in the UK would be extremely different from someone else in another continent. So yes, these are actually a part of the whole food systems functioning, but these are really heavily influenced by the external drivers that you can see below. For example, the climate change. So people tend to have like some preferences because of what's going on, social cultural context, policy, leaderships, and advertisement. Like a lot of things really influence food systems. So it's really enormous, the complexity of food systems. So other organizations are focusing on this aspect and what influences the preferences of individuals instead of their food choices. But as I said, for us, we simplify things and we focus on this for drivers. But thanks for asking. It's quite an important question.
So on the food supply, if some grains coming out of Ukraine, but if it doesn't, there's going to be devastating, isn't it, on all these figures?
Yes, yeah, definitely. And this is exactly what's happening as well. So, which is why we've put conflict as one of the major indirect drivers of malnutrition. Any other questions or observation? Okay, in that case, let's jump in on an activity that we have for you. So you'll see a couple of, let's say, interventions that are listed on this slide. So you'll be divided into breakout rooms, and I would like you please to discuss whether you think they are indirect or direct determinants of malnutrition. So are those interventions influencing directly or indirectly nutrition outcomes? And then we go back to the plenary for discussing. So we have 10 minutes. Is it right, David? Okay. Do you have any question about the exercise? Hope this is clear for everyone.
Can you just explain that one more time, just in case? Will you put something in the chat for that?
So I hope you will still see the slide, but just in case, yes, I can definitely put that in the chat box. So for an intervention which involves receiving breastfeeding counseling, does that directly or indirectly affect nutrition outcomes? And then you can discuss. So I hope you all had good conversations. So the aim of this exercise, instead of deciding strictly if they are direct or indirect, was to have a conversation on how you understand those interventions. So, because in my advocacy, I have some understanding on if they should influence directly or indirectly nutrition outcomes or food systems. But what I would like to hear from you now is any specific things that you have discussed with the groups that you would like to flag about, like something that you have perhaps not understood what me to explain, or if there is something about the indirect or direct drivers that you would like to discuss or to ask. So please go ahead, jump in.
We weren't sure whether being trained on nutrition and cooking was, we thought indirect, but we weren't 100% sure about that.
So which one, sorry?
Being trained on nutrition and cooking.
Aha. So what was the conclusion on this one? Do you have any?
Indirect. We thought indirect.
What do others think about this one?
What did other people think?
Oh, Sarah, I think you're speaking on it.
Yeah, my thinking was that it could encourage change, but it wouldn't directly affect change because you don't know how much people will actually take away from that cooking lessons and whatnot.
Yeah, this is how I will understand it as well, as being sort of indirect drivers, although it affects like the direct impact of food, nutritious foods, but it's part of the food systems and everything that shapes the environment and the understanding and the cognitive knowledge of nutrition. So this is how I understand it. But how about breastfeeding? I've heard very interesting conversation about this one.
I would say breastfeeding is direct, definitely, because it's healthcare. It's a type of healthcare educate, or at least in this country, it's provided by healthcare professionals, right? Midwives are part of the healthcare system. And if they come to your house or you go to them and they teach you about breastfeeding and stress the importance of that, well, that's a service, what was it? A preventative nutrition healthcare service.
Yeah, this one was a little bit sneaky on me for putting there, because yes, actually it's part of the healthcare system, I'd say, preventing malnutrition by providing breastfeeding support, counseling, etc. So yeah, this one I did understand it as a direct influence of malnutrition or good nutrition for that matter. Any question about this one or any other?
And we said reforming international trade rules was direct, I think. Was that okay?
What do others think about this one?
I would say indirect, because it's on a wider scale. It's like trade, international trade and so on. So that has a trickle down effect, but it's not kind of like something that is on your door, like, because the two direct ones are healthcare and access to the nutritious food, right? And I mean, I guess that eventually this will give you more access, maybe depends on what kind of the reform is in the international trade rules, maybe. So it could, but I think it's more of like something to do with the food supply chain. So therefore I would say indirect. But relating to this one, I thought it was the other one, I think maybe it was the one after it, was a bit similar, but there was a little bit more intrigued to know if you would say indirect or direct. Investing in territorial markets at local, national, and regional levels, because on one side it's also kind of similar to like reforming international trade rules. It's like a bigger context or coming from a bigger level, a systematic change. But at the other side, maybe this will directly open a farmer's market next to your house, and then that does affect your access, your direct access. So that one maybe is more in that direction, that's in between the two.
Yes, so that one was actually my attempt to reformulate the access to nutritious food into access to markets, because access is not just about being able to afford, but also being able to physically reach nutritious food. So yes, I personally understand this as direct, but also heavily influenced by food systems. So yeah, this one can be quite complex actually. And for the reforming international trade rules, think about what's happening in Ukraine at the moment, when trade rules have been massively affected internationally because of that conflict, an upset conflict. So yeah, it's a sign that it's quite an indirect drivers, but influencing very, I would say, like it's a reality for people's malnutrition.
Let's not confuse direct or indirect with important, because something could be indirect, but as with the war in Ukraine, several stages down the line, it has a massive impact. So indirect doesn't mean less important necessarily.
But please tell us the last one was direct. Please, 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 can we get the one right?
The last one is both, actually.
What?
Sorry, it was a bit too hard. So the last one is both, actually. Yeah, because we are talking about cash transfer.
Direct, direct.
Yeah, for accessing nutritious food, we are talking about social behavior change, communication, etc., which is also indirect. That one was hard, I'm sorry.
I just want to say, Richard, it's not a test. It's
the discussion.
Anyways.
I was very competitive, you see. I always like to win. I always want our team to win. I don't know what the prize is, probably another session on nutrition tomorrow night.
How did you know, Richard?
Back to the PowerPoint. Can everybody see that? Great. Okay. So the second and last part of this training is about advocating against malnutrition. So here is a picture of the pledge, of the UK pledge for N4G, which has been announced on Twitter. So after, I would say, years of work, the UK pledged to spend at least 1.5 billion on nutrition programming over the next 8 years. So while the pledge was actually advocated for, it was still a vital achievement. And it sets, I would say, a minimum spend for nutrition that our parliamentarians are keen to see raised over the next several years. So how have we achieved this? So we are at Results advocating through a policy advocacy, but also with parliamentary. So I'm going to first talk about policy advocacy. Thanks to all of our collective efforts, we have secured the financial commitment and also the adoption of the OECD policy markup. So for some of you who have written for demanding the adoption of the OECD policy marker, you know what I'm talking about. And this is the result of the long collective advocacy and policy work. First with ICANN. So ICANN is the International Coalition for Advocacy on Nutrition in the UK, but also globally. And in the UK, it includes multiple organizations, collectively implementation of policy financing at FCDO in order to tackle malnutrition. And our grassroots members have played a key role in our advocacy by putting our policy reports into campaign actions and directly writing to the Secretary of State ahead of the N4G summit and ask them to commit. And as we have heard when meeting with the FCDO nutrition team during our advocacy day in July, but also last year in September 2021, grassroots actions are and will remain crucial to ensure that civil servants at FCDO commit to nutrition. So yeah, this is my way of saying thank you for everybody who participated into this, because it has been a real game changer for securing that pledge. In our parliamentary advocacy, so it allows us to take the policy ask directly into Westminster. So a large part of this advocacy involves building relationship with parliamentarians and sensitizing them to our issues areas and values, so they themselves can become passionate and informed advocates for nutrition. So our parliamentary champions in both houses ask written and oral questions. They sponsor and speak in debates. They write letters to ministers. They host events. Speak directly to their colleagues about nutrition. So, for example, so this is a written question from one of our champion, Chris Law, and its response from Minister Milling. So, just an example. And how we do parliamentary advocacy. So, the APPGs, so all party parliamentary groups, this is one of our key things. So the APPG, for those who are not aware of how they function, they don't have an official statute with Parliament. So unlike, for example, the committee group on the International Development Committee, but they are still very useful to organizing advocacy around specific issues areas such as nutrition. And these groups must contain members of at least one of the two parties. They must have at least one representative from the House of Commons and the House of Lords. And they are very, very useful for building a cross-party support for an issue, allowing members from all sides of the House to pursue common goal. So the APPG for Nutrient for Growth, now it became the APPG for Nutrient for Development, but we'll come to that after, which Results UK provides the secretariat for, was founded in 2019, and its initial purpose was to build support for the 2020 N4G summit in Tokyo, including securing a strong financial pledge and commitment to reaching 50 million women and girls with nutrition programs. But after the COVID-19 pandemic into the UK, I would say parliamentary advocacy experienced a drastic shift, and instead of international meetings, in-person debates, the APPG work moved online. So members attended virtual evidence sessions on different aspects of nutrition, and they were kept to date on the latest N4G news through regular briefings. And when the Tokyo Nutrition Summit family happened, the APPG first was quite disappointing when initially the UK failed to make a financial pledge because they made it 2 months after the summit. They made it this year in February instead of December during the summit. However, they did commit to adopt the OECD policy marker on nutrition across LCDO programming before and at the summit.
I have to say, I think we met Mr. Sharma when we went to APPG. Yes, I had a long talk with him. I thanked him for being an MP, and he said, "We do get paid, you know." And he kept, sorry, I mustn't go on about it. He came over to this country from, I think, India as a bus driver, and now he's an MP. How about that?
So thank you for volunteers for doing that, you know, from your free time.
He's a very important ally on a number of the issues that Results works on.
After the government, the pledge, the group began to look forward in the future. So we have rebranded the APPG for Nutrition for Development. The aim behind this new shift is to broaden the scope of our work beyond N4G framework, while still advocating for the expansion and timely implementation of the UK pledges. So it's critical time for global nutrition, actually, especially with the Russian war in Ukraine, with climate change and disaster and the continuation of COVID-19 pandemic, because they are all posing severe threats to nutrition outcomes across the globe. And the APPG is currently having some event planned, especially toward hosting an event at COP27. So what's happening also in our advocacy for N4G, not that the summit has been passed since December. So given the lack of progress to meet the global nutrition targets that I've covered earlier in this training, and the effects, long-term effects of the pandemic on malnutrition, advocacy focuses on demanding increased financing for nutrition to the UK government and on maintaining the N4G momentum across civil society, but also in government. The aim of that is to ensure that financing for nutrition reaches the level needed for meeting the global nutrition targets by 2025. And yes, that's in 3 years' time. So no time to lose on that. And to enable meaningful progress, the N4G summit pledges must be reached, and the UK government should be held accountable for the commitment. So accountability is now a very strong theme in our advocacy. And in 2021, only 63% of policy commitment goals set by donors and 42% of financial commitment goals were on course to be fulfilled and reached. So only 42% of financial commitments were on track to be reached. So there is a very clear need for the ODA donors to honor their past commitments, the one that they've made before the N4G Summit 2021. So while advocating for increased nutrition financing, demanding accountability for previous and current commitments, it's equally essential. And it's especially important since the countries that have been the hardest hit by the economic impact of the pandemic will be unable to step up domestic resources sufficiently. So this is very important for ODA donors to honor their commitments as soon as possible, especially in the light of the Ukraine war. So we are asking for N4G pledges to be delivered on time in our advocacy, as well as a general increase of donor countries' ODA budget to help offset the expected decline in government expenditures on health and basic nutrition interventions in the next few years. So for our campaigners, there are a couple of take for supporting our advocacy. So for instance, that could include writing to our new Secretary of State on the impact of the war in Ukraine on malnutrition. You could also contact your MP to raise awareness on the links between climate change and nutrition. So for this one, we have in the slides a link of an excellent blog written by my colleague Kate on nutrition and climate. And our coalition ICANN UK is currently advocating for an additional 70 million pounds to wasting treatment in order to reach 1 million malnourished children. So yeah, there is a very big momentum at the moment for wasting treatment because of a procurement issue. So we know that the treatments and procurements of everything needed for treating wasting has been like heavily disrupted as a result of the Ukraine war. So increasing ODA and the financing for wasting treatment is very key at the moment. So these are just a couple of examples of what companies can do for supporting our advocacy in that matter.
So that's a big thing to ask us to do, those three things. I mean, have we got briefing notes or anything that we can structure a letter with, or is that sort of separate?
Can I jump in here?
Yeah.
So as you know, Richard, we have a monthly action with all the sort of briefings that come with that. We haven't developed one specifically for this because we know that people sometimes want to do additional things. So this is very much about whether you want to go further. In terms of this information to support these, we're going to, in the notes section of this slide, we put them in the chat, Matilda, maybe? We've got there's a slide coming up in a second on further reading, which gives you the information that's necessary or would help you to raise these issues. You can do, of course, your own reading. But we're not planning to produce the normal action sheet on all of those issues, just because we can only do so many at once, and we have to prioritize what we think is the most important action at any moment. And in fact, our next monthly action coming up will be on education. We've just done polio, but that's not to say that nutrition isn't important. So for those of you who've learned a bit more about nutrition tonight and want to do more, we have given you some further reading, but it's not in the format of our normal monthly briefings, I'm afraid. That just wasn't possible.
But you've done a nutrition one before, haven't you? Monthly briefing.
We have 3 months ago, I think, 2 months ago. You can find.
Okay, so we can go back. If we haven't done that, we can go back. Yeah,
you can. You won't get everything you've heard tonight, but as I say, we'll share the slides. But you will be able to see a very overview description of where we've got to with nutrition in the. Was it June, Matilda? I can't remember, but
yeah,
go on my webpage. You find the Take Action section under Get Involved. And you will find all of the previous monthly actions, including one on malnutrition.
Okay.
I mean, this is too much to do in one letter. This is very much about finding their own interest. What is it that? And one thing I wanted to finish on, really, if that's okay, Matilda, to just move into this. At results, we do think about what we think is the most potentially impactful action at any given time, which is how we choose our monthly actions. But there's so many things to do at once, and we knew that if we wanted to sort of help people understand where we've come to with nutrition after, there's several years, as you've heard tonight, of advocacy, and what are the challenges that are coming up now, people will want to take action on that. So that's why we've chosen those 3 strands. And if any of you find that you do want some more information, then please do get in touch with us. You can contact me at the first point of call, and I'll get back to whoever it needs to be to get that information to you. But we always ask people, think about what your own interests are. What is it that you know about? What is it that you care most about? And take the actions that you feel would be making the best difference in the world to people's ability to have their right to nutrition. If you want to discuss that with us, as I say, we're very happy to do so. But at the end of the day, results is about helping you unlock your own, what we call personal political power for change, which is basically you as campaigners doing what you want to do.